So we will have a look on the special indication, and Giovanni Volpicelli, which is a member of WinFocus, explain us three organizations. The first is the sorting of the patient, the second is the quantification of the lesion, and third is the follow-up of the patient. We come back to the COVID-19 in France, and we can see that the lung ultrasound could be really used in the city when the people are with general practitioner who can use lung ultrasound at the beginning of the on the first time they see their patient, but also for the follow-up and to have the image again, maybe to at day 5 and 7, but maybe also at day 10 and at day 16 and 20. We see lots of patients who come back to see their general practitioner because they have also many signs, and we can see that they have images on the lung ultrasound, which explain more and more problem with the pulmonary, with the lung. Sorry, after the main 2 weeks with the coronavirus. We can see also the lung ultrasound is also in the hospitalization before the patient is coming in the hospital, because it's really easy to perform the ultrasound, and we have the results before the PCR test and before the CT scan. About the quantification, there is no clear data, no studies about the quantification, and told you that, and the empirical approach and previous experience on different diseases like influenza A is really important. We have the experience of Spain friend who did this image. I will send all the image, of course, of the PowerPoint for you. The three signs is the interstitial syndrome, and you will have B lines. If you have more than 3 B lines in the intercostal space, you can tell that your patient have an interstitial syndrome. So he have to be controlled at home. He has to be follow up. When you see the third image, you can see that there is more and more B lines, and also there is an irregularity in the pleural line. I will explain you all the signs just after. And the Spain people said that it's better to have an hospitalization with people who have this kind of pattern on maybe more than 20% of the lung. The third image is the consolidation. I told you about the hepatization of the lung. It's when the lung is transformed and has a tissue-like appearance. With this kind of images, if you just have 1 or 2 images on the posterior part of the patient, there is no problem. Of course, you have to keep your knowledge and the saturation, the oxygen saturation, to decide if the patient has to be hospitalized or not. But if there is more than 10% or 20% consolidation, really careful about that. We have also a very important sign is the patchy distribution. It's like you have some intercostal space which are really normal, and on the other side you have some just the intercostal space very near. You have lesion like interstitial syndrome. The sorting. It's really important to imagine. I think maybe in Iran you have lots of people who arrive like us in emergency, and it's really difficult to wait for the PCR, nasal test, and to wait for the CT scan. Maybe it's like in France, in some special parts, some special region in France, the CT scan is not so easy to have, and so it's really interesting to have the lung ultrasound to really screen the people and decide if they can go back home, if they have no lesions. They can go in the medicine unit if they have some interstitial syndrome, and if they have more than 20% of the lung with the interstitial syndrome or consolidation, they have to go very near the ICU. Of course, the sorting is also the sorting with the lung ultrasound, but also with the other ultrasound techniques, with the abdominal or the heart ultrasound could be useful to detect other problems of the disease. And of course, we have also some people who have the problems and who have not the COVID-19. So the first take-home message I will send you, that it's that in France we do the screening with the PCR and the CT scan, and we use the ultrasound, the lung ultrasound to do the sorting of the patient, to have the good orientation. We do also the screening with the general practitioners who did that a lot, and at a really important place between the day 4, day 5, and day 7 to really target the patient who will have a severe form of COVID-19. And of course, I will explain you the follow-up in ICU. We can manage the patient. We can manage the position of the patient with the lung ultrasound.